In this episode of the Aging Well podcast, we welcome back Doctors Emily and Mitchell Clionsky, authors of Dementia Prevention, Using Your Head to Save Your Brain. With over 50% of dementia cases potentially preventable, the Clionskys emphasize the power of proactive brain health strategies. Building on our previous discussion, we'll explore updates and dive deeper into actionable ways to protect cognitive function, emerging research in dementia prevention, and how their personalized approaches have impacted patients' lives. Let's uncover how we can all use our heads to save our brains and age well. So, Emily and Mitch, welcome back to the Aging Well podcast. You were guests on, I think it was episode 120. You've been our go-to references when we talk about dementia and brain health. So for the viewers and the listeners who are new to the podcast, can you give a quick introduction to yourselves?
Sure. Mitch?
No, ladies first.
Hi. I'm Emily Clionsky. I'm an internist and a psychiatrist and a researcher in dementia and dementia prevention. And the work that we've come up with in our book has really come out of our clinical work with our patients over the last 20 some odd years, longer than that.
And I'm the worst half. I'm Dr. Mitch Clionsky. I'm a clinical neuropsychologist. So a lot of my work is done in testing people's ability to looking at how well they're able to pay attention, to remember, to solve problems, all the different aspects of thinking, as well as their emotional state. And coming from a background both as a professional, now really doing this for, in my case, 45 years, and unfortunately having a mother who also developed dementia at an age in early 70s. I've seen this really from both sides, from the caregiving side as well as from the professional side. And so together, it's really sparked our combined interest in letting people know how they can do things, change behavior, live their lives in ways that can reduce their risk of dementia by 50%. That's a big number, but it's an achievable number for many people. That's why we're happy to be here again to talk with you, Jeff.
Well, two great brains working to save the brains of all people. That's awesome.
Thank you.
And so the book's been out for a little over a year now. Have you received any surprising feedback from readers of Dementia Prevention?
Not so much the readers, but in terms of the people that I wish we did. We have a place on our website, braindoc.com, where people can actually connect with us and send in questions and things like that. So we're really interested, but mostly with the kinds of things we go out and do talks, either to professional groups. We were down talking last September to to a hospital in Philadelphia and to their geriatric staff and their psychiatry staff, neurology staff about dementia prevention, but also to a number of lay groups, people who are in the field, either caregivers or people who are members of the community. And they have fascinating questions to ask. And so this always keeps us on our toes. Probably the one thing that we keep returning to, however, the one question I think that keeps coming up is that people are shocked that there's something that they can do that reduces their chances of dementia. It's like the basic premise that even though they've come to this talk about dementia prevention, they're like scratching their heads. You mean there's something we can do about this? And then they want to go through the supplements that are out there on the shelves that don't work, and they want to ask about specific berries and fruits that might overcome everything else because they've got those berries that they're eating and they're avoiding McDonald's, Burger King, or whatever. So those are the kinds of things we typically get asked about.
It's amazing that we are so treatment oriented in this country that we can't believe we can actually prevent the diseases that we want to be treated for.
And that is true not just about dementia, but just about a great number of what we consider the chronic diseases. If we think about diabetes, if we think about high blood pressure, if we think about cholesterol problems and the strokes and the heart attacks that result from them, those are highly preventable conditions. All we have to do is really exercise, watch our weight, and watch our diet and maintain a healthy lifestyle. Avoid the alcohol, avoid the tobacco, certainly.
You
Avoid
didn't mention
marijuana.
cancer. Seriously, I mean,
No, and
there's
you're right. I mean, if we think about it, we can significantly reduce different cancer risks by changing behaviors. So you're right. And it's not that this is new information. Chronic disease prevention, whether it's about dementia or any other condition, is not new. We've known this for, in some cases, 50 years.
So the question becomes, I think, how to change our basic approach to what we do with our lives over the course of our lives in terms of health, and how to make it sexy, how to make it interesting, so that we're not just talking about this cure. The basic idea is you can spend whatever you want, but somebody else will come in and pay for it at the end. You can live your lives in any way you want, and somebody come up with a cure at the end. That just doesn't work very well. Getting that message across, just living in a way that respects what health is about, is a hard message.
And although I think people now in their teens and their 20s are more aware of what they need to do to have a healthy lifestyle overall, it's not as strongly adhered to a message as it needs to be. There's a narrow segment of that population age group that's paying attention. We still don't have that as an ethic in our country, that you really are responsible for your own body. You can be in control of your own health. And the sooner you start doing that, the better off you're going to be. And the better off our society is going to be.
But part of it is that we're always, I mean, I remember being a teenager. I remember being a guy in his 20s. I was invincible. I was immortal. That would happen at some future point, way in the horizon. And that time differential, which is one of the things we talk about in the book, is the disconnect between what I do now and what I have to pay for later. It's not immediate enough. I can eat whatever I want today. I won't have gained weight until probably a couple days from now, when it actually all happens. I can smoke cigarettes today. I don't have to worry about it for a while. I can drink alcohol excessively today. Maybe I'll get some problems immediately, but most of the real issues that we look at are distant. And that's hard for people because our brains are set up to deal with immediacy. Mm-hmm. It's cold. I don't care if it was hot in the summer. I need to put on a coat today to survive. That's how we're organized. That's how we're wired. I'm hungry, so I'm going to eat now. The fact that it might screw up my blood sugar later on, that's a different issue. It's not like putting your hand on the hot stove where immediately it tells you don't do that. And that's what we're dealing with. How do we bridge that becomes the question.
I try and emphasize to my students the tragedy of the commons. I don't know if you've ever read that article from 1968. It was Garrett Hardin. It's really relating more to natural resources and growing population. And it's like back then it was like 5 billion people they were panicking about. Now we're up to 8 billion. But I try and stress to my students that we have the same issues when we talk about healthcare. And if we're not preventative, we can't afford. I mean, you can talk all you want about universal health care, but until we have universal health, we can't afford universal health care.
Isn't that the truth?
Take that certain level of personal responsibility.
Absolutely. Couldn't agree with you more, Jeff.
One of the things I wanted to talk about a little bit today, if it's okay, is a tool that we developed called our Dementia Prevention Checklist, which we have in the book. We've gone a couple steps beyond that since we were last with you. We have now put this on entirely online and allowing people to take the test through their computers, through their cell phones, through their tablets. It's about 15 minutes long. There's 25 questions. At the end, you have to pay a small fee for this. I call it the co-payment fee, $15. It's going to generate for you a personalized dementia risk profile. It's going to tell you what your dementia prevention quotient is, your index, how close you are to hitting all the marks. It's also going to give you another metric that was developed out of Harvard called the McCants Brain Care Score. We were able to use a lot of the data that they have so that people who are going about this in different ways can compare where they are. But then it's going to give you a colorized dementia prevention map set up like a stoplight. So anything that's green is go. It's good stuff. You're on target. Things that come up yellow on your map are things where you're close to, but there's some caution there. You got to maybe work on those. And then there's the red lights, the places where you are off target, you're too far away, either in your blood levels of something or your behaviors like your exercise or your diet or your sleep is disrupted. Below that, next page is an actual columns of each of those. So it gives you where you are on target, near target, and off target, but then an individualized plan after that to show you what you're going to want to achieve in each of those areas. So we're looking to give people something that's actionable, that says to them, this is my personalized kind of thing. I can take it now and I can go back 6 months from now, do it again, see where I have. And I'm hoping that personal trainers, hoping that primary care doctors, other people in the general population who take this seriously are going to want to have their own tailor-made profile. It's up on braindoc.com, and we're hoping your platform, your podcast will be a way for people to say, wow, that's something that I want to do. I want to see where I stand, and I want to see what my focus is for the next 6 months.
Yeah, we'll include that link in the description notes. And
thank you.
Upcoming in my pathophysiology and exercise class, I always push you guys in that class. So that gives me something else to push to them, to show them what they can, is there going to be personal trainers, physical therapists, PAs, whatever it might be. They have that tool that they can now carry with them to encourage people to include in their kind of evaluations of their health. So that's awesome. My next question, you kind of read my mind a little bit. I got to say, you're a psychiatrist or a psychic? My next question was going to be, since our last conversation, what have been some new developments or insights in your research or practice regarding dementia prevention? Has there been any other changes other than, of course, you have expanded on that particular tool, but obviously you've probably put some more tools into that tool, if that makes sense?
There's a couple things that we've added that we do think are important that have been somewhat overlooked. There's been some research over the last year or so regarding vaccines to prevent inflammatory diseases and infectious diseases that have shown that if you get routine vaccinations like RSV vaccinations, shingles vaccinations, as you get older particularly, that anything that causes you to have a strong response to an infection increases your risk of cognitive decline. So whatever you can do to prevent that is really good. Preventive dental health. I'm not sure if we talked about that very much.
We didn't talk a lot about that, but it's really important. Periodontal disease is directly attributable. I mean, you can get dementia from that because of the bacteria and the inflammation in the mouth, and actually continuing to weaken the blood-brain barrier, and that bacteria can cross into what should have been protected spaces in the brain.
So we tell people that we want them to really regularly use the F word. They smile like you did. And I said, the word is floss.
The last time you used a comment about looking at your butt.
Examine your butt.
Yeah, so you're giving us all these little smile phrases that we can use to encourage people to get healthy.
Figured out how to do the flossing too, because I used to not do it because it's the strings and you're going out there and you got your mouth and you're cranking it open and spit's getting all over the mirror. It's a mess. It's a disaster. Then my dental hygienist showed me these little curved dental picks. I don't know if you've seen them.
Mm-hmm. And they've got little brushes on them too.
I know they're great because you can carry them around. They give you a little carrying case for them, so you don't have to worry about what am I going to do if I'm out for dinner. And those you go in right through the front, and they're so easy to use, and the mirror is pristine at the end. And so that's what we're doing now. We're flossing with the little dental picks.
I'll have to try that.
It makes a difference. It makes a difference in certainly in your periodontal care, but it's going to make a difference in your brain.
Yeah, my hygienist said, "Wow, your gums look so good. This is incredible." I said, "Well, I'm actually flossing now."
We had a how should you classify it? A green dentist on one of the recent episodes, and I'm trying to think which one it was. I don't have all the numbers in my head the way I should. I always am amazed at podcasters that say, an episode such and such. Unless I prepare for it, I can't remember what episodes people were in. But her name is Dr. Nami Patel, and she's out of, I think, the San Francisco area. And she talked about all these same things, how, proper dental care can give us 10 extra years of life. And so I love that this podcast brings me to people who are all kind of giving different dimensions of the message. We've learned about sleep a lot more. We've learned about dental care now. And, I don't have to just talk about not smoking. I don't think we've had anybody that's telling anybody not to smoke, because if you're smoking at this point, you just are clueless to the ill effects of it. Oh, there's so many of these little things that we don't even think about. And you mentioned, did you mention that, the shingles vaccine? And that's one of the things, my doctor has been on me for years to get that vaccine. And I'm like, I'm not really worried about shingles. And now, I don't know if you're underscoring
Wait
my
till it
resistance.
gets you.
Well, I'll tell you how we got
You'll
the
be
shingles
really
vaccine.
miserable.
One Saturday morning, I go across the street to my friend, who's the same age as I am, where we used to live, and it's a couple that lives there, because I need to borrow something from Harry. And he comes to the door, and he looks miserable. And he's a robust guy, and he like barely can move. I looked at him and said, "What the heck happened to you?" "I got shingles." I said, "You're kidding." I took about 2 steps back at that point.
I don't think they're contagious, are they?
I said, "You know something? Whatever I need to get from you, I don't need to get it today. I'll see you a little later." Walked back across the street, went into our house, said to Emily, "We're calling over to the pharmacy. We're seeing if they've got shingles vaccines, because that's where we're going this afternoon." And 2 hours later, we were vaccinated. And I'm real
Absolutely.
glad that we did.
Absolutely.
So
It's amazing, because you don't appreciate, again, people don't appreciate that our bodies are constantly changing. Whether we're just born on this earth or whether we are 95, our bodies are constantly evolving and changing. And unless we're doing something to get them better, I can assure you our bodies are getting worse. Most of the things that happen in that regard is that we lose our innate protection. And when I said shingles will get you, and it will be by surprise, because it doesn't give you a warning, the most you're going to get is this nasty little sensation that there's some burning somewhere. And the next thing you know, you can be pretty uncomfortable. And I'm talking pain for days to weeks to months. And right now, I'm taking care of a woman who, other than shingles, would have been just fine. Where this virus came out was in the mid thoracic area of her spine on the left hand side. And it has never gone away. It has left such incredible damage to the skin and that whole entire dermatome that this lady is on Oxycontin, and she needs to be. Gabapentin, cannot get in and out of a bed by herself. It can have really shocking effects to you. And so you need to take the immunizations when they're indicated, because you can never really tell where your own immune system is at with respect to efficacy in preventing these kinds.
Okay, so I'm going to end the interview now, and I got to run to the pharmacy.
Good.
Well, like we had some furniture delivered 2 weeks ago, and by the time these two young guys had left our house, we already had designed a smoking reduction plan for one of them who was still smoking 2 packs of cigarettes a day. So this is our mission. We go around preaching medical health.
That's good. Okay, so you
It
changed my
doesn't bore
mind on that
people in the
then.
con.
So are there any other particular habits or interventions on the checklist that you feel that are underappreciated by the public?
Well, it's not really so much on the checklist as it is something that I've become even more painfully aware of than I was perhaps even 10 years ago. And it's coming out of my forensic practice, where I have seen so many criminal events really arising from the use of drugs and alcohol. People still to this day do not understand the damage that can happen to your body and your brain as a result of marijuana use. So I realize that 26 states have now legalized it, but please appreciate the fact that marijuana stays in your system a long time. Even though you may have smoked it 3 days ago or eaten it, 5 days ago, whatever, 20% of what you ingest is going right into your fat cells, including the myelin layering in your covering in your axons and your neurons in your brain. And it's being redistributed in your body. So you may think you're just doing fine. In reality, particularly if you are a user who's using this drug every 2 days, every 3 days, you've got marijuana at a level in your system where it actually is affecting your brain and how your brain is functioning. The other thing is, I'm addressing this to younger women who are still capable of getting pregnant. A lot of women, but we still really don't have a good way of detecting internally that we're pregnant at 2 weeks or pregnant at 4 weeks. Maybe we start to feel it 4 weeks to 6 weeks to 8 weeks. If you are exposing a potential baby to marijuana in any way, shape, or form, particularly as now it's being advocated for pregnant women who can't sleep at night, that has devastating, enduring cognitive consequences to that unborn child. There ought to be posted signs in every single dispensary in states that actually sell marijuana. If you are pregnant, do not use this drug. Just like we have on alcohol bottles, don't use this, don't drink alcohol if you're pregnant.
Yeah, I stress to my students, particularly the females, is like if you are at risk of getting pregnant or trying to get pregnant, you got to realize that so much critical development of the fetus occurs in the first month or 2 months before you even realize either, yay, I'm pregnant, or I'm pregnant.
Yeah.
Right. And so I was not as aware of that with the marijuana. Now, when you talk marijuana, are there any particular components of the marijuana that you see as we remove those from the rest of the kind of the drug that can have some benefit, or is it kind of like all aspects, all that? Because I'm hearing different stuff. They're able to isolate different types of the CB, or they, I always want to say CBTs, and I know it's not CBTs. You can tell I smoke marijuana, right?
Yeah, it's when we talk the major active component of marijuana, it's your delta 9 THC.
Okay.
So there is no benefit to that.
Except recreationally.
And I would debate that because of you weigh the risks and benefits.
Oh yeah.
Yeah.
And the risks far outweigh the benefits of any bit of recreation.
The interesting thing about those in the dispensaries is that over the course of years, the intensity of the THC has skyrocketed because the percentage, because that's where they realize the market is. So back in the 60s and 70s, Haight-Ashbury, all the different college campuses, people were smoking 4% THC in brains that were about 20 to 25 years old. Now, many of these same people who are my patients are 70 to 75 years old. They're using products which begin with 16% THC, go up to 30% THC, and even beyond that. The math is really where the detail is. 50-year-old brain, 4 to 5 to 6 times the THC content is not a good mathematical formula. And we see people, and the other thing is half-life. You have to understand half-life. It's not just you use it now and it's out of your system 2 hours, 6 hours from now. But as with all drugs, the half-life persists. That's what allows us to start with a low dose of something and gradually raise it and have an effective dose that's higher than the individual dose, because things hang around. We don't clear it out of our system. And so there's that as well.
And if you're buying marijuana off the street and it's boosted with something, if it's stepped on with either cocaine or PCP or fentanyl, God forbid, you run a real risk of having extreme things happen to your health. There have been 3 cases that I've been a forensic expert on in the last year where people actually took loaded guns in our downtown area and shot them off after smoking marijuana that was laced with PCP. They didn't know it was laced.
So is there any medical benefit at all to THC?
No, there's been no randomized control trial that has demonstrated that THC has yielded any benefit in terms of disease states of which we're aware.
So it's sort of like, the way that the dispensaries are set up. is there's no real way of anyone knowing what they should be using or what benefit it has. Sort of like if you went into your pharmacy and there's this 19-year-old kid behind the counter and you went up to them and said, I'm feeling sort of nauseous these days. What do you think I should take for that? He said, I got this real good stuff here, and it's good for nausea. I said, I'd like something else also that would help me to sleep better. Oh, I got this for you as well. This people are saying works well. It's a crazy kind of system where half the time the people who are making suggestions are people who are high. It's pretty interesting, right, isn't it?
Now, the one interesting thing that, and most people are not aware of this, but acetaminophen, a popularly trade name Tylenol, for a long time, we did not understand why Tylenol worked. We knew it was different than aspirin and different than any of the NSAIDs, the non-steroidal anti-inflammatories like Motrin or ibuprofen or Advil. We didn't know how it worked and we knew it worked in the brain. We knew that it wasn't working at the site of where the inflammation or the pain was. It was working up here somehow. Well, it turns out that Tylenol or acetaminophen is active at the CB1 receptor, the cannabinoid receptor, which is pretty much distributed throughout the entire body, but very predominant in the brain. And sure enough, there is anything in, if you're smoking dope, you may be getting the effect on the CB1 pain relief. There's other ways to get that pain relief other than smoking marijuana. Try Tylenol.
So would you recommend Tylenol or not recommend Tylenol?
Well, for somebody that it depends on what they're using it for, and just assuming that they do not have end-stage kidney disease or end-stage or even renal disease, and if you are mindful of how much you use, and if you understand that if you are drinking even a glass of wine a day, that you should only take 1/2 the recommended daily dose, maximum dose. So it depends what the patient's pain is about, what's causing it, and what dosing level we need to prescribe. I'm not opposed to Tylenol, believe me.
So the medical disclaimer to underscore here is talk to your physician, talk to your pharmacist before you take any medication.
Absolutely. Absolutely.
And take it as prescribed. I see a lot of people who take medications in a variable way. Well, I didn't think my blood pressure was high that day, so I didn't bother. I mean, seriously, this is what I hear on a frequent enough schedule over a course of a week that it shocks me, where they're taking medications based on random choices they make during the day. And maybe people that are listening and watching this podcast, that's not me. I always take my medications very reliably, which is wonderful. But a lot of people take things in a way that is so inconsistent that they get maximum side effects, minimum benefit from it, and even worse, they don't know if it's working or not. They claim it's not. So they go from, we see this a lot with the antidepressants, they go from one to another because they've underdosed it, they've taken it inconsistently, and it didn't work. Well, it wasn't going to work because they didn't even start off by taking it reliably enough to potentially work. So, take it as prescribed is really, and if you're having a problem, talk to your doctor. Don't just stop it, talk to somebody before.
The other thing, and physical therapists, I believe, are aware, at least all the ones I've known are aware of, pain, gate control theory of pain. So basically that says you've got X stimulus that's producing pain, that's being perceived by the brain, and you take a pain medicine. What you need to do is keep taking that pain medicine on schedule as prescribed, so your stimulus you're not lowering the stimulus threshold to trigger the pain response. So you're controlling the gating of that pain stimulus. And that's one of the things that pain medications are helping with. So if your doctor tells you to take something every 4 to 6 hours, take it every 4 to 6 hours. Even if at 4 hours you don't feel like you're in pain, well, if you don't take it then, you're going to be in potentially more pain later, and it will take greater amounts of medication to get you back to where you were to begin with. Does that make sense?
Yes, it makes great advice.
It's funny. We got lots of advice about things. Getting
Yeah.
people to actually say, "Okay, I'm going to work with that." That's the next step, and that's hard. But
Well, I hope our listeners are listening to this and realizing you two are experts and you're giving good advice. We wouldn't have you on this podcast again if I didn't think you were, good doctors to, direct us in the right direction. And so if you're listening or watching this podcast, pay attention to these two. They're pretty bright people.
Thank you.
You're welcome. So, kind of shifting gears away from the drugs to kind of monitoring sleep. Since our last conversation, I got my Garmin watch. I'm actually wearing it today. The battery life is horrible on it. The only disappointment I have, so like every other day, I have to take it off and charge it through the day so I can have it for night. So I wear it every night. But what are your thoughts on the growing use of wearable technology and AI for kind of tracking not only our brain health and our sleep health and things like that, but just generally cognitive health?
I think it's real interesting because from a tech perspective, it's attractive. And I think that's so you have people actually paying attention to their health because they like tech. And I think that's great. I'm a little concerned and I see this in my practice, where I think this person has a very high likelihood for having sleep apnea. And their response is, well, I'm wearing my watch and it tells me I'm not having this. I say, really? How well is it measuring your oxygen levels? Well, it has a metric in there. There's an algorithm that tells me I'm probably doing okay. Well, I said, here's one of these things where you're probably better off actually getting the real test and then using this for things like, because it's really looking, I think, activity while you're sleeping. And so if you're not moving a lot, it makes it look like you're sleeping really well. So I think it's great. I think that there's some really cool ideas that are coming out there. But again, it's a bright, shiny object. So it doesn't take the place of actually working to change your behavior. It does give us information back about how we're doing.
Yeah, I would much rather have somebody spend $180 or $200 on a home sleep test, even if their insurance company doesn't pay for it, and get that test done and take a look at it and say, yeah, I've got obstructive sleep apnea and I can take the next step and take control of my health and get on CPAP, get on continuous positive airway pressure treatment, or I don't have it this year. And, if somebody says that when they're 30 and they're 10 pounds overweight and they're lucky enough not to have it then because maybe mom and dad didn't have it, so they genetically didn't get that gene. But then after having two children and maybe being 25 pounds heavier at 35 than what a woman was at 30, maybe it's time to get that home sleep study again, because she may have developed obstructive sleep apnea. So that by the time that we get to be 58 years old, what is it? 50% of us?
At age 58 or older, people from the general population. So we're talking about a study that was done, published and they drew 6,000 people from the general population, split up into 6 or 7 different centers like Framingham Heart Study, Mayo Clinic studies, very reputable kinds of places. And they gave them all one night of a home sleep test. 50% had sleep apnea. Now, the vast majority of those were cases of mild sleep apnea. So only 5 to 10 times or 5 to 15 times an hour, these people stopped breathing or their oxygen level dropped. But that's still a very significant, I always say people, it's only mild. I said, well, you're married, right? And they said, yeah. I said, how would you feel about your wife putting a pillow over your face for 10 seconds, 10 times every hour while you slept? Is that a good idea? And they laugh, of course. I love it when they laugh because that's figure, okay, we're connected. And I said, that's what's happening. You're not getting air. You're not getting oxygen because of that air. And the one cool thing that really has happened this year is the first study with people where they're actually able to visualize the glymphatic system clearance in our brain. So the glymphatic system, as you know, is this vascular system that clears out the buildup of trash, toxins that are produced while cellular activity occurs during the day. And it only occurs during the deepest stage of sleep, stage 3 sleep. Well, up to now, we've been able to see it in lower animals. We've hypothesized that's what's going on with people. And there were these studies where they looked at a series of people with Parkinson's disease, where they put wires into their brain to be able to stimulate particular areas of the brain to stop the tremors. And they were able to put cameras in there, and you could actually see the lymphatic system clearing out, flushing toxins into their circulatory system so that it would be washed out overnight. I just thought that was sort of like,
That's pretty
here's the
cool.
picture of this. Seeing is believing. I know even today they've got special effects and everything, but this is actually true pictures of what's happened. And that was very cool because we've sort of known it, but now we tell people this is one of the reasons you want to be able to sleep soundly and not be interrupted by gasping for air.
And we talked off camera about how difficult it is to get to that point of having the sleep, the overnight sleep test, and, get on your doctor early about that. Because I think right after our interview with you is when we have, my chart here where, I can communicate with my doctor, and I put a message in there, mentioned you guys and your book and the interview, and said, I'd like to be tested, for sleep apnea, and never heard back anything. I heard him back, and then I had an interview or my wellness checkup a little late in the fall. So, oh yeah, and I noticed there's a note in here, about sleep testing. Do you still want to go through with that? And so I got the referral, and of course, it took me a little bit of time because of my schedule to be able to make the call and get it scheduled. But I'm thinking, okay, I'll get this scheduled. It's a home test. They'll send it to me, whatever. No, I have to go there, and I have to drive pretty far to get to the hospital or the facility to pick it up. I have to pick it up and then take it home. And then I'm supposed to have it back by 10 a.m. the next morning. And it's like, well, I work an hour from my home and you're another 45 minutes from my home. It's like, I can't do that. So I'm picking it up and then to schedule it, the earliest date I could get it scheduled was in March, to be able to get it on a Friday and be able to have it, my wife's going to have to drive and drop it off the following Monday. Like, that's crazy. I mean,
It is
no wonder
crazy.
people don't do these tests.
Mm-hmm.
It's like, make it easier for me to get this and get the test done. Why does it have to be back the next day?
There are a lot of companies that don't have that kind of requirement. It's a question of where that particular primary care doctor or pulmonary sleep doctor or healthcare center has arranged to get the home sleep test, because it's more common than not to just have the home sleep test delivered to the patient's home with a box that you just, after you're finished with it, you put it back in the box, and FedEx or UPS takes it back from you.
Wait till Amazon does it. It'll just be delivered the next day and picked up the day after.
Yeah, and then you can take it and drop it off at Whole Foods or something like that the next day,
Exactly.
and it's super
Please
convenient.
keep in mind that there's still, depending on who your insurer is, how you get your healthcare insurance, there is not eagerness on the part of payers to pay for tests, because when they test somebody, chances are they may find something they have to pay for the treatment.
Mm-hmm.
And I hate to sound cynical, but insurance companies do not exist to improve our health.
No,
They exist
you're
to
making that
improve
up.
the financial health of their shareholders. So
Yeah.
that's what you're dealing with. So when I literally said a couple of minutes ago, I'd rather see you, go online. There's probably a company online that you can, get a doctor to simply write a prescription for you to do a home sleep test. Or order the home sleep test, get it online, have it delivered, pay $180, $200. If it was your brain, and that was, you were going to save 6 months of your brain, it's probably worth $200.
I should reach out to my physician and push for that. See if there's a way, even if I have to pay a little bit more. Because even from the inconvenience standpoint, I mean, taking the time to go pick that up, my wife to have to take time away from work to go deliver it, it's just insane.
It is
Now, I
insane.
know that you can go right up online and type in home sleep test, and you'll come up with several sites that are very reputable that will do this. Question is, will your insurance pay for it? Don't know that, but they're going to ask for a prescription, which then can be uploaded. So it's not, your doctor can write that prescription regardless. question of who's going to pay for it. But just as Emily says, it'll get delivered. You put it on one night, goes over like your finger, down around your wrist.
Sensor underneath your nose. Boom.
Sleep, you send it back the next day. They send you a report because they've got board certified sleep medicine doctors who interpret it. It's not like there's a huge wait for those kinds of things. This is actually, the next step. The next step will be, how do you get the wearable stuff to be able to give you this without that interface? We'll see.
Yeah. I did buy myself a nighttime pulse oximeter, and I think I told you that a while back. But that alone is not going to give me the information I need. But
right, because a nighttime pulse oximeter, first of all, you need to be able to record the heart rate and the oxygen levels throughout the night. Can yours do that?
Yeah, it does it throughout the night. So it records, I think, to my phone. And so I did it a couple nights, and my pulse oximetry was fine. I don't think it dropped below like 96 the whole night. But again, is it picking up everything? Is it?
And you may be one of the 50% that doesn't have this. You're in great shape.
And you're young.
I'm not that young. I'll be 62 in April. So
you're still in the
So you have a statistically 50% chance of having this, but probably moderated by a lot of other things, like, how intact the muscles are in your neck. And you look like somebody who probably has pretty good musculature in your neck.
Well, I always tell my students, if you're going to work one muscle group in the body, it's the neck.
Really?
Because it's the only muscle that anybody can see. Like, I'm doing this podcast, I could have a big old beer belly, you wouldn't know it. But if my neck is looking really, really scrawny, you're like, work out, right?
Okay, now I need neck exercises.
The question for me is always, how do I do my neck without hurting my neck? Because it's, for whatever reason, I recruit the muscles in the neck for other things like shrugs and stuff, and I end up with a neck problem afterwards. So I don't do them so much because of, I probably just need someone to show me how.
Yeah. So strengthen the neck, get your nighttime sleep test done, and what else?
And try to do something for fun that is physical. An example that's very personal to us is my husband decided to give me dance lessons as from one of my Christmas presents. So we are actually taking dance lessons together. And I'll tell you, at the end of an hour of ballroom dancing, we're using muscles that we haven't been using before, and we're very aware of them, and
Plus
we're
a
tired.
Lot of thinking. There's a lot of thinking in this that it doesn't look it should be, but there's parts moving in certain ways or sequences that really I think stimulates your frontal lobes, your executive functions.
Absolutely.
But the other part of it is, and I think is related to that, is it is social. And, one of the big things that people are now addressing is the epidemic of loneliness, particularly in older people, and how that is a risk factor. So the number of times you are with people, number of times you're interacting, really helps to reduce the likelihood of depression, the likelihood of isolation, self-disregard that oftentimes is a precursor for bad habits and poor conduct. So this sort of checks all the boxes. It's social, it's romantic, it's executive planning, it's physical. So who knows? Maybe we'll do the next book on dementia prevention through dancing.
There you go.
And even if it's not romantic, we happen to be going there as a couple, but there are people that are going there individually, and they're just doing it because they like the activity and they like being able to do that and learn in a way that's very comfortable, and it is a social outlet for them. So I'm becoming an advocate of dancing.
I think it's important. I mean, from an exercise science standpoint, we talk a lot about the health components, or the health dimensions of fitness, but we don't talk for the aging population about the neuromotor skill related, and agility being one, because we think of agility as just something athletes do, but there's that cognitive agility that we should be doing as we age, so that we're able to make those quick decisions, whether it's for gait or whether it's for preventing dementia or other illnesses. I think it's important.
So
I hate dancing, but
I'm sorry.
No, I was going to say I hate dancing, and my wife will probably listen to this and say, "Oh, see, now you got to take me line dancing again."
I guess my question, Jeff, is how can somebody develop cognitive agility? How does somebody do that?
Well, just doing any activity that requires more than just a kind of memorized pattern, doing things that are requiring us to change direction quickly and accurately, but making a quick response to do it. So we don't know where we have to go until some signal triggers us. And it might be, lights. I mean, I've done stuff when I had my training facility. I would have athletes. I had bought laser pointers and I would use those and make them like have to follow it like a little cat,
Cat.
doing stuff like that. And, or just, walking different patterns. It's like, telling them which direction to move.
So in our case, Emily's following me as I'm leading. She has no clue because I don't know where I'm going. So it's actually very good for her brain because she has to about figure out where the heck is he putting his feet? Which way are you going here? So see, it works out well, honey.
And that's where I think dancing does that, because especially if you're dancing in a room with other people, because now you're having to respond to where they are.
Mm-hmm.
And it's not just, okay, I'm standing here, I remember the old, I forget the organization. It wasn't the Fred Astaire dance thing, but it was like some organization back in like the 70s, 80s. They used to have like the feet things that you could place out on the ground. And then you mimic those to learn how to do the waltz or whatever dance step you were doing. And we tend to learn to dance that way. Where it's like step, 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 step. And it's all very rhythmical. But once you get into that room with a bunch of other individuals, now you're having to react to them. You're dancing with somebody else. And, if they're as bad a dancer as me and they're leading, yeah, you have to respond to their imperfections in their dance moves. And so I think that's a great way, but there's ways that we can even refine that further. One of my guests recently was Kedrick Bloomquist, who he works for a company called, I'm going to mess it up. It's Reactin. And they have like a treadmill that not only elevates, but it also goes on a decline, but it also moves side to side.
Wow.
And you control it. And so there's like, I think he said there's like 800 different patterns that this could do. And so it always becomes very, reactive, where you're having to make these immediate adjustments to the perturbation as you're walking for your exercise. And it's like, wow, that is such a brilliant piece of equipment, because we walk on a treadmill and it's like the same pattern. It's not like even going outside where we might have to make minor adjustments for cracks in the sidewalk or uneven surfaces or things like that. For me in the morning when I have to get up and feed the cat, our current cat's pretty good. He doesn't try and trip me up like the last two cats, dude. But you know, you you need those things that are going to make you have to react to different movement patterns as opposed to just memorizing and doing a particular pattern. So there's some cool stuff he could do, and his products, the company he works for has some pretty neat stuff.
Thanks for mentioning that. It sounds fascinating and wonderful.
Yeah.
There's a nice literature for Parkinson's patients on the value of dance. In fact, one study showed that it was about equally as effective as formal physical therapy for balance. So again, all those different aspects of where we are in space and that, and stimulating various aspects of our brain.
Yeah, it's interesting with like Parkinson's that like boxing is actually a very beneficial therapeutic treatment.
So I'm going to tell you a story about this. So we have a friend who has had Parkinson's now since his late 60s. And one of the other friends of ours had heard that he was involved in doing boxing. And he called me up, my other friend, and said, Mitch, do you think it's a good idea for him to be doing boxing? I mean, with head injuries, with all that stuff. I said, no. They're not boxing against each other. They're boxing, they're shadow boxing, they're hitting a bag, they're doing that kind of, okay.
I don't know. Would you pay to see Parkinson's boxing matches?
Outrageous. Absolutely outrageous.
So we're tying in all these different guests that I've had recently. I mean, I just had a recent guest about art, and we're talking about the role with Parkinson's and brain health and cognitive ability, and all of the different benefits of that. And then I mentioned Nami Patel and the dental hygiene, and that goes back to sleep apnea too. We talked a lot in her episode about she's kind of anti braces because they changed the mouth dimensions and doesn't give the tongue enough room. And she talked
Hmm.
about doing tongue exercises, which I should be doing. Told my wife about it, and she said, "Don't do that. It's annoying because it's like doing those little clicking sounds with your tongue and doing." I told her that Gene Simmons must be like really free of sleep apnea because of what he can do with his tongue. But it's just interesting that there are so many different things that we can do that we're not being told that these are the things that are going to benefit us the most. It's like, well, you're getting older, dementia is inevitable, and when you get there, we'll just give you these medications. I love talking to you all because it's like there's hope for people that are younger that maybe even have a family history of dementia. It's like you don't have to get it as early. You might not be able to prevent it, but you can slow it, you can delay the progression of it, and there's plenty of things that we can do individually to kind of protect ourselves against it.
One of the things that we will also talk about a lot is mostly for your kids, but the importance of advanced education because that builds cognitive reserve. It's like having a team where you've got a better bench than the other team. And so, you may have some injuries in your first string. They may get tired during the course of the game. It may come down to who you have on your bench who can go in at those times. And that's something that gets built up cognitive reserve by having mental stimulation. So, these days, having people go on beyond high school, whether it's to a trade school or a community college or to a regular 4-year college or university, is a really great insurance. And when you have people and the kids say, well, I really am tired of this, I want to go and work, you say, well, let's see how we can build in some further education. If you want to work in some area where you have to learn how to run a CNC machine, or you have to learn how to do other things. Go to HVAC school. We need a lot of people doing HVAC work. You get a plumbing license. This is problem solving. It doesn't have to be in a formal university, but it's really important that people begin at that point to extend their thinking powers.
Are there any other specific tools or apps that you recommend can help people stay a bit more proactive about their brain health?
Something, it's hard to do that because there's not a lot of evidence showing that brain games effectively work for most people, let alone all people, or that a particular brain games work on any particular functions. It's one of these things that everyone would love to have. They look at the brain as a muscle when it isn't. So, repetitive kinds of things like that typically get people better at playing brain games. You'll run across studies that say, oh, these people who did this particular brain activity had better functions in this way, or they're slightly better in terms of their MRI scans, but nothing that's been consistent enough that we feel comfortable saying, here's what you should do, or that we would do. In our case, I don't think it's necessary because we're still working 6-7 days a week. I'm not advocating that, but it's like, oh God, do I have to play a brain game now? I don't even have the energy to do that.
Rather than playing a brain game, I would advocate that the time that you were spending on a brain game, I would rather have you spending it walking, running, jogging, treadmilling, bicycling, swimming.
Doing it with other people and listening to podcasts while you're doing it. So you're stimulating all those things at the same time. That would be the perfect intervention.
And reading books like Dementia Prevention.
Or listening to them. Ours is on audiobook. So anyone who doesn't like to read that much can get a nicely read book by Nan McNamara, professional actor. So there's lots of ways to consume this. Or your podcast. You can listen to that.
Yeah. And when it comes to reading, I've put a lot of books onto my iPad because it's so convenient to have on there. But now it's like, but I don't want to read those before bed because that can have that disruptive effect on my sleep. But I do better if I read a paper book, and so I'm trying to kind of be balanced between the books that I get in paper and the books that I get, on my iPad, and read things at different times so that I'm getting better sleep.
Try audiobooks too.
Can you turn your iPad on like a white on format so it's not sending out as much light? Is it night
or do
dark
your
mode?
Do your night vision. Yeah.
I haven't tried that. I should see if I can do that on my iPad. Probably
if
can.
You've got an iPad, you can do it. It's in the system setup, and you select night vision, and you can actually tell it what hours you want the night vision activated, so that what it's doing is it's cutting out the blue light.
That's a good tip. We've been getting a lot of
Problem
good tips
solved.
today. I hope everybody's taking notes off of this podcast. So,
But the other thing I would
whatever.
also advocate is for people who really don't want to read visually. Audiobooks are a really interesting way to stimulate another way of getting information into our brains. We're 80% visual learners. I mean, 80% of what we get into our brains as human beings comes in through the visual pathway, not the oral pathway. But if you really start to train your brain to pay attention to what you're hearing, over time, and when I say over time, I mean over a year to 2 years, you will notice that you can become much more orally oriented. So again, you're just building a different pathway.
My concern with audiobooks right before bed for me is that I would, be listening to a chapter and then I'll fall asleep and then I'll wake up, I've missed like half the book. So I wish they could like turn off as soon as it recognizes that you've fallen asleep.
I can't
I
fix
have a
that
long
one
commute.
yet, Jeff.
But you know something? That's why you can rewind those things. It's not like it's gone.
Right.
That's true. That is
Exactly.
true. I
Exactly.
tell my students if they want a good night's sleep, I do all pre-lecture slides for my classes now. I said, well, you
Yeah.
can listen to this before sleep, and it'll help you, get a
Exactly.
little bit better sleep hygiene, put you to sleep.
So we could package these instead of those people who are using all the sleep medication, just Jeff Armstrong slides. Here's a package of these and no problems, no sleep onset problems.
So what do you say to patients who feel overwhelmed by the idea of trying to overhaul their lifestyle? I mean, you're giving us so many great tips. I hope nobody's sitting there saying, oh, this is too much. I just can't do all this. But how do you encourage small, sustainable changes?
Well, number one, that's why we have this kind of focused kind of checklist, because you don't have to do all these things. And so we want to give people a place to say, okay, where do you want to start here? Do you want to start with the things that are close to being on target? Because they'll just need a little nudge, perhaps. Your body mass index is a little higher than it should be. You're having a few more cocktails you might think is healthy. Or you want to start with the hard things and pick one of those. And it may be that it's smoking free. People still do smoke a lot. Is it that it's exercise? Because if you can tackle that and increase that, that's where we talk about breaking those down into small bites. So you can have the best looking apple and say, I'm hungry. I want to eat that whole thing. I say, yeah, but you better not try to do it in one bite. So we got to nibble. So you start with those kind of things, knowing that if they can build that habit through that approach, they will learn about habit change, number one. They'll get successful and feel good about it. And in the process of, for example, exercising 10 minutes at time, 3 times a day, which is really doable, at that point, probably start to feel a little better physically, and they'll start to want to do some other things. And that's where it begins to spread into other areas. So we talk about, finding a place. You got to start this vicious cycle that's working negatively. You got to change it someplace in there. What's best for you? Where do you want to start? So that's the question I ask people. Where do you want to start?
Pick one thing, concentrate on that, and appreciate the fact that a new habit takes about 6 months to really become ingrained.
So start early if you have a lot of bad habits.
Well, learning the first one and making a change is going to spill over. That's really the optimistic message I try to give people, is that so if you're exercising more, guess what? That sleep onset problem that you're having may improve because now you're tired more than you were when you tried to go to bed before. So now you may not take that over-the-counter sleep pill that you were taking that suppresses your acetylcholine levels, and because it's anticholinergic, that may be getting in the way of your thinking during the day. Because of this, you're going to do it. So it's all a matter of, okay, and coaching helps. I really appreciate when people have personal trainers, coaches, somebody who can. We think about it in athletes all the time. You're having trouble locating your fastball. Well, it's really good having somebody out there who's saying, I've watched film with you. Did you know you're hitching your arm when you're doing this? When you're batting and you're lowering, you're dropping your wrists. Well, there's a problem here that we can correct for. So having a personal trainer or coach, that can make a world of difference. Plus the whole, we're in it together. I'm here to give you support and encouragement. It makes a lot of sense as well.
And I think that looking at it as a preventative thing earlier in life rather than later.
Mhm.
An understanding, and I'm hoping that younger people listening to this podcast are recognizing that when we talk about aging well, we're not waiting until we're in our 50s, 60s, or 70s to age well. That we emphasize that, and you kind of made the point beyond birth. I mean, we talk about that aging well begins at birth, but in reality, it probably even begins before birth. It probably begins at conception, or maybe even a little bit earlier if we start looking at epigenetics and some of those types of
Yes,
things.
it does. You're right.
So what would it be like? So what would it be like for your students to hook up with a person in a senior living community to become their dementia prevention trainer? That's my question.
Well, first of all, with this generation, you don't say hook up with.
Sorry.
That's right.
Take on
That would be totally inappropriate, but
but it would get the seniors more involved.
yes, they would be very happy. Yeah. Um, and maybe the kid would too if you're not being as lucky in college. But I think it'd be a great thing, and I've been emphasizing a lot more that we need to building senior communities closer to colleges, maybe even on college campuses,
Mm-hmm.
because you build a senior community on the university campus. Programs like mine, which exercise science, where we have students that are going to be occupational therapists, physical therapists, doctors, PAs, as well as trainers. You can connect them with individuals that are going to, you're going to get work experience. The student's going to get work experience. The seniors are getting that interaction with the young people. They're getting many of the treatments that they need. So it's like a win-win for everybody.
Sure is.
And it's like, why aren't we doing that more?
Mm-hmm.
Because there's great opportunities.
I
And
agree
we
with
just interviewed the other day a young lady from University of Michigan that is an ambassador for this program called Care Yaya. It's a group that they connect college-age students with elders that need care, and it kind of addresses that kind of sandwich generation where you have young kids you have to take care of as well as your elders. And really, really awesome program. It's like, well, why don't we have that in more colleges? And it's kind of that same thing. These kids could be, working both in kind of giving exercise programs to these seniors, as well as kind of helping them with, some cognitive stimulation and just the social interaction and kind of ticking all the boxes that we talk about. We got work to do in our communities, I think, in terms of addressing accessibility and opportunity for all. I mean, we kind of talk about all these things that people should do and should be doing to be healthy, but inevitably somebody's going to be saying, well, I'd love to do that, but I can't do it because. And we look at, well, you got to find your whys when with exercise and health and all those types of things. But for many individuals, it's a why not as well. And if we don't address as communities, as a nation, all those types of things, the access to these things that we want people to, it's like, getting your sleep apnea test. It's like, if you can't get access to it, what good is it? But, same thing, if you can't, you don't know how to exercise or you don't have a facility to exercise, we can sit here, until we're blue in the face saying you need to exercise and you need to do all these things. But if people can't afford it, can't have access to it, then how are they going to do it? We got a lot of work to do.
We do. Thank you, by the way, for inviting us today. It's always interesting to hear where your head's at and what you're hearing from other folks, because certainly getting that kind of feedback gets us stimulated to think about things in new and unique ways. So
Indeed.
it's great to hear your perspective on some of these things. Thank you for that.
Well, thanks. You guys help me grow my perspective all the time. So, and this podcast for me is shaping my approach to being an exercise physiologist, being an educator, being someone who wants to promote healthy aging and do it to not just the third act generation, but people that are in their 20s and younger. So this is great. I mean, I love these conversations. This is why I love doing the interviews a lot more. And we probably should be wrapping up here shortly because I know you guys said you had a busy day.
Yeah,
We do. Yeah. We're
Yeah,
off
we-
to do a bunch of things.
As we wrap up, is there anything else you want to add to the conversation? We want to kind of underscore where the listeners and the viewers can find your book. And if there's any other links you mentioned, and we'll have you repeat again the link to your test and any social media, anything else you want to share?
Probably the easiest in terms of anything is on BrainDoc, BrainDoc, brain.com. That's our website. It's got all kinds of different links to it. It's got the dementia prevention checklist. It's got a link through Amazon to get, as we said, it's on audiobook. It's in libraries. So if you're just wanting to borrow it, that's also fine with us. We're really happy when I think it was Vancouver Library had like a dozen copies of it. I thought, wow, that's either they have a lot of need or they're really forward thinking. I'm hoping it's forward thinking.
Maybe the librarian forgot they ordered it.
It could be. We keep getting these books. I don't know why.
Maybe they should read it.
But that's what we really I'd like to plug. Plus, I'd also like to make a personal appeal to your wife to get you out dancing. Go sabotage you right
love
there.
it. You'll absolutely love it.
I can't edit these podcasts, so.
The power of the
But
edit.
I need to do those things more. So you've encouraged me.
Good. Wonderful.
Great.
Right.
Thank you very much for inviting us back. This was wonderful.
Oh, thank you both. We'll have to have you on again just for periodic updates on just kind of what's going on with dementia and, the research that's out there, the treatments, the prevention, and really kind of what you two are up to. Because I love talking to you two. You guys are a bunch of fun.
Thank you.
Thank you.
Same here.
Likewise.
Yeah. So you have a great rest of your day and keep aging well.
Thank you.
Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.